This video shows the team approach prosthetics for the Tri-Lobe implants. The surgical specialist should provide this to his or her restorative dentist. The Tri-Lobe implants come in 3 implants with different fixture mounts. The RePlant comes on a fixture mount that can be used for a temporary abutment or for a transfer. The RePlus comes on a fixture mount that can be shortened to be a snappy abutment. And the reactive comes on a fixture mount that can be shortened to be a preparable abutment. The surgical specialist would attach the healing collar, suture. He would then place the fixture mount that came with the implant that he had inserted into the vial along with its screw. With each implant shipment comes instructions for use, and in that packet are 5 patient labels. The surgeon would then write the patient's name on this label, the referring doctor, and the tooth number of the implant. Place this on the implant vial containing the fixture mount, being sure not to cover the second tear-off label that can be used by the restorative dentist for his chart. Send this implant vial with the fixture mount to the restorative doctor, along with a downloadable letter that explains all of these procedures. The restorative doctor can see what the tooth number is, remove the healing collar. In this case, it's the fixture mount for the reactive implant. Can be attached, used as a transfer. Also, the RePlant and RePlus fixture mounts can be used for transfers. And also, there are closed and open tray aluminum transfers that are available. Seal the opening with a cotton pellet and some putty. Make the impression. This is a closed tray impression procedure. Long screws are available for this fixture mount if you wish to turn it into an open tray transfer. Using either the 1¼ millimeter hex tool or the Unigrip Nobel tool, you can remove the screw from the fixture mount, reinsert the healing collar, then the restorative doctor would send the impression along with the transfer and lab instructions to the lab, where they will attach the fixture mount to an implant analog, insert it into the impression, lining up the flats with the flat in the impression. They will apply a soft tissue replica material to eliminate any undercuts and to simulate soft tissue. Pour the model in dye stone. The lab can then remove that and select from a variety of abutments or modify that abutment. Here we see that the RePlant system contains straight contoured margin abutments, straight zirconia abutments in 2 different collar heights with contoured margins, an oversized lab abutment that can be prepared to any angle or margin position, a snappy abutment that comes with a snap-on comfort cap, angled titanium abutments in 2 different collar heights, 15-degree angled abutments, angled zirconia and titanium abutments available in 8 and 15 degree angles, gold abutments for fabricating custom cast abutments, plastic temporary abutments that can stay in the mouth for up to 6 months, plastic castable abutments, non-engaging titanium abutments for converting dentures for teeth in a day procedures, these multi-unit abutments for fixed attachable restorations, GPS overdenture attachment abutments compatible with the locator zest attachments, and finally the ball abutment for overdenture attachments. For most cementable restorations, the lab technician will be able to use the fixture mount of the reactive implant. He'll attach it to an implant analog, section off the square part using a carborundum disc. This abutment now has a 1.5 millimeter high horizontal margin. The abutment will be reattached to the working cast, tightened down with finger pressure, and prepared for any minor angle corrections and to adjust the height of the margins. The hole will be sealed to allow waxing of the metal framework and fabrication of a ceramo-metal restoration. Restorative procedures will then simply be to remove the healing collar, attach the lab-modified abutment, tighten to 30 Newton centimeters using a torque wrench, put a cotton pellet and some putty or wax to seal the screw chamber, try in the crown, check for occlusion, and cement the restoration.